just need to give it out.
Oh, okay. So as long as you're giving it out, more is coming.
Yes. One consultation fee is way less expensive than chemo or surgery.
True.
So weigh those costs and then take the step. Just gather your wits about you. Sometimes you are really, really afraid that you might get some bad news. But that is why you should read. Even women as young as 18 are developing breast cancer. So it all must be aware of.
Hey guys, we are back again on Just the Play podcast, and we are in the Breast Cancer Awareness Month. And we can't do this without having to talk about breast cancer. So today I'm having an amazing female. She's a doctor amongst us today, and she's going to tell us everything you need to know about breast cancer, how it develops, what causes it, and how to stay healthy enough not to get breast cancer. We are hoping we get tips on that as well, and also the myths surrounding breast cancer. Hi, Klenam.
Hi, Mercy.
How are you doing?
I'm doing well.
How are you feeling today? How's your day been?
Oh, it's been good. Since I set off in the afternoon, there's little traffic in town. So that's a good thing.
That's a good. Oh, it was less
traffic,
than the usual.
Yeah.
Oh, okay, I get it.
That's something to be grateful for.
Yeah. So, Klenam, please tell us something about yourself.
Okay, so I'm Jemima Klenam Ahlijah.
Ahlijah, that name. You said you mentioned I know someone from my senior high school. She was called Ahlijah.
Well, I think, but you might never know where you find your relatives.
I know, right? I know, right?
That's a good thing to think about. So I'm a medical doctor. I'm currently in transition, so I don't have a permanent place yet. But in this month of October, we know that the breast cancer awareness is going on everywhere. Yeah. And so wherever that we find ourselves, we're able to bring awareness, we're able to give information and to educate the public on what it is and what it is not. So personally, I enjoy public education. I enjoy interacting with people. I enjoy sports too. I'm a Liverpool fan.
Hey, why not Barcelona? Why Liverpool?
I never walk alone. Why are you in the Spanish league anyways?
I don't know. I'm not that much of a big
football fan. Is English.
Oh, yeah. Okay. It's all about Man City.
Yeah, so City is cool, but they are like newcomers. So it's for those who don't want.
I hear Liverpool is for the old people.
Yeah, so that's the thing about being a fan. Through the lows, through the highs, through the bad times.
Wow.
Yeah, it's actually only recently that Liverpool started, shining again.
Oh.
So we are with you. But you see, the motto is, you never walk alone.
Interesting. Yeah. I'm hearing that you're talking about football. Wow, that's nice.
Yeah. And so, every opportunity I get, I make the most of it.
Okay. So can you tell us what breast cancer is and how it develops?
Okay. So, we know what cancer is.
Yeah.
It's an abnormal growth, okay? So, we have... A cancer is an abnormal growth that spreads to other places. So you can have different types of what we call a tumor.
Yeah.
So the tumor is the bigger picture, the bigger group. And then out of that, we have the what we call benign tumors and then the malignant tumors. So the benign ones are like good. It might be a growth, but it's not dangerous to the body.
Oh.
So maybe it might just look bad to look at. Like sometimes you have a swelling on your skin. It's just not aesthetically pleasing, but it's not harmful.
Okay, with the swelling on the skin, does it become big? Or
no, it's just an example.
It's
just an example.
Okay.
Sorry. It's just an example.
Okay.
But, like the tumors are an abnormal growth. So you can have those that are benign, sort of not harmful. Then those that are malignant, that's bad. So the malignant ones are the ones that we call cancerous. Because apart from the organ that they grow in for the first time, they also spread to other places. Yes, so that's when we have issues with it. So you can have it developing in different organs. So the common one of the commonest is breast cancer. Now, breast cancer is the leading cancer in women. diagnosis wise, and then if it comes to how many people die of it, it's the second after lung cancer.
Wow.
Yeah, this is general statistics. Most of them based in the US and the UK, but we use them anyway. Yeah. So it's, you can see that it affects a lot of women. It has implications for, women are the center of society. So it has implications for families. It has implications for people's companies. If it doesn't just affect the woman, it affects her children, her husband, her church.
So is it the
social,
the social part of it?
Yes. So if a woman has breast cancer, it doesn't just affect her alone. It has implications for all the things that she holds on to, because women are everywhere. They hold everything together.
Everywhere.
So it's very important for us to talk about it and have more information about it. So, sorry, the question was, what is breast cancer?
Yes, and then how it develops.
Yes. So, breast cancer is a cancer of the breast tissue. So, in the breast, you have the fat. You also have the ducts, the ones that produce milk.
Yeah.
Where the milk is produced, and then the tubes it passes through to get out. So all of those tissues can develop cancers.
Oh. Wow.
Yes.
New knowledge. So new knowledge.
Yes. So breast cancer is, the breast tissue is what you can see what it is, but microscopically there are different structures in there. So all of those different structures, the cancer develops from, and you can develop from any of them.
Wow.
Yes. So it's generally, there's no fixed cause per se. It's not like a mosquito will bite you and you get malaria, and we know that if you kill all the mosquitoes in the world, we'll be free of malaria. Cancers are more difficult to combat that way. So we don't have a specific cause, but there are risk factors.
Yeah.
Things that you do or you have that may predispose you to getting the breast cancer.
Oh, so what are some of those risk factors?
Okay, so some of them are what we call modifiable. Some are non-modifiable, is you can do something about it. Non-modifiable is you cannot do anything about it. Yes. Okay. So first off is age.
Age.
Yes, age. As you grow up, there's a likelihood that you might develop the cancer, especially for post-menopausal women.
Oh, okay.
Yes. So above 60 years, those are risk factors. It doesn't mean that after 60 you get it, but it's a risk factor. And the fact that you're a woman as well. Some men do get it, but mostly is for is a woman that gets it. Yes. And then sometimes there are also genetic predispositions. So if there are genes that predispose you to getting it. An example is the BRCA1, BRCA2. It's BRCA 1 and 2. Yes.
I saw it when I was researching on breast cancer.
Yes. So that's one like that. It usually happens in a family. So the BRCA2, for instance, also has implications for developing prostate cancer, pancreatic cancer, ovarian cancer. So it might not just be that people in your family have breast cancer, but maybe the men might have prostate cancer, or pancreatic cancer, or colon cancer. It's a whole family. So as long as unfortunate,
as long as you have the BRCA genetics, you're like, you can get cancer of any form.
That it's a group of them. So the breast cancer, they have this link. It's not clearly defined, but we can note that from a cohort of people that are studied, they work together.
Oh, okay.
They work together. Yes. Okay. So if we are taking a history, you ask if any cancer in your family. No, maybe they are thinking of just the breast cancer, but you ask about prostate cancer, you ask about ovarian cancer, you ask about pancreatic. No, not lung cancer. So as I said, it's a group.
It's a group.
Yes.
So it's not all cancers that belong to that group.
No. Wow. No. It's a group. But yeah, and then also there's the familial part. So if you have a mother or a sister who's had it, you're also likely to develop it. Yes. Wow. And so for the non-modifiable ones, yes, those ones you can do something. No, you can do something about some of them. Yeah. So, for example, breast cancer has to do with estrogen being available in your body for a prolonged period of time, and so when you have menarche, that's the first menstrual period. That
Yeah.
shows that you are beginning to have your
Transition into a woman.
into a woman, and a woman is estrogen that makes a woman. Okay,
Yeah.
so early menarche. Nowadays, a lot of people start menstruating very early. Yeah, but that has been shown to be a risk factor for developing. But so from the research, it says below 13, but also you have to consider the length of estrogen exposure. So this is an aside that when a female child is born, you are born with your whole set of eggs for life. You have a particular number of eggs for life, which are released once a month.
Really?
So you don't produce any new eggs as you develop. And when the eggs finish, they are done. So sometimes you can have early menarche, but it means that you go into menopause early because your eggs are done. So then that leaves you with a shorter duration of estrogen exposure. So it's not just because you have early menarche, that's why you are at risk. But then it also goes with late menopause. So having menopause after 50 years, that is also a risk factor.
Wow.
Yeah. And then when you have your first full-term pregnancy after 30 years old, that's also a risk factor.
Wow.
Yeah. And then not giving birth at all. It's also a risk factor for developing breast cancer.
That's insane.
Yeah. And then those ones are usually, and then doing hormone replacement therapy after menopause. You see, sometimes the menopausal symptoms are difficult to deal with, and so we give them medication to help them through their period.
Oh.
Yeah, but depending on, it's a case by case basis, but for especially women after 65 years, it's not recommended that you start the hormone replacement therapy because it has been noted to have a risk factor.
Okay.
Be a risk factor for developing breast cancer. Yes. And then prolonged use of the oral contraceptives too. So the pill, the pill, there's a mini pill and there's the pill, but we are talking about the pill itself. So that is a combination of estrogen and progesterone.
Wait, one quick question. What's the difference between the mini pill and the pill itself?
So the mini pill, there are different contents. So the mini pill is just one part of it. So the progesterone pill.
Oh.
Yeah, both of them do the same thing, but their components are different. But it's the combined one that is shown to be more giving you more risk factor.
Wow.
For breast cancer. Yeah. And then also there's good old smoking.
Yeah.
Smoking and alcohol. That one we can do something about it. So yeah.
Okay.
Smoking and alcohol. And then being overweight. Obesity, especially in postmenopausal women. But the fats that you store in your body has a way of being converted into more estrogen. So the more estrogen, the more risk factor you have.
Wow.
Yeah. So obesity, sedentary lifestyle, which is linked to the obesity, because if you are sitting at one place for a while, you gain weight.
Yes.
So those are some of the risk factors. Let me see. Did I talk about breastfeeding? Yeah,
No.
exclusive breastfeeding. So that's one for the breastfeeding mothers.
Wait.
So not breastfeeding your child is a risk factor. Your heart caught.
I'm like, hey.
Yeah, not breastfeeding your child. It's a risk factor. Yeah.
So for the mothers that they have the milk, but then they pump it into something.
Yeah. So
does the child's mouth need to be on the nipple to be like you're breastfeeding the child, or you can pump it into something and then feed it to the child?
Yeah. So the protective factor is when you have been breastfeeding for 6 months. There are reasons why the mothers pump the breast milk. Maybe they might not have time. So that's in itself sets the stage for maybe she adding formula. So she's not doing exclusive breastfeeding.
Oh, so exclusive breastfeeding is the one to the mouth.
Yes. No, exclusive breastfeeding is feeding a child just breast milk for 6 months. But I'm talking about the challenges with that.
Oh, okay.
If you express the breast milk and that's all that the child eats, it means that it's a cycle. So the more milk that you express, the more milk that will come.
Oh.
Yes, and that is the protective part of it. The fact that you are cycling, the milk is coming. So for six months continuously, the milk is coming. And the higher the demand, the higher the milk being produced. So the baby gets it. It's like you just need to give it out.
Oh, okay. So as long as you're giving it out, more is coming.
Yeah. So that's a protective one. But then if you are not exclusively breastfeeding, we don't really see much um protection from that one.
Okay.
Yeah.
Okay. So now let's talk about females getting breast cancer and males getting breast cancer. What's the difference? Because what breast does a guy have enough to expose him to breast cancer?
Yeah, so as I said, the breast has structures.
Okay.
Yes. So you have the glands that produce the milk with their ducts. Then you have the fatty tissue in there. Then you have the ligamentous tissue holding the breast together. So for women, we have more fatty tissue there.
Oh.
So that's why it's that obvious. But we have the same basic structures as the men do. So sometimes for men that store a lot of fat, like people who take in, well, for alcoholics and then obese men, you can see that they actually have boobs.
Yeah, it's
Yes.
true.
So we all have share the same basic structures, so that we store a lot of fat over there.
Oh, so those people like that, the ones that are exposed more as a male to breast cancer.
Well, not exactly, but I'm just saying that we all have breast tissue. And so whatever can happen to the goose can happen to the gander. So whatever can happen to the female breast can happen to the male breast as well. Just that for the males, it's not very common. But then if you are not lucky and your house people are wearing black and blue and you you get an issue with your breast as a male, you have to take a World Cup.
For real?
Yeah, because it's not that common. And so when it happens, you really do have to do something about it.
Wow.
Yeah. Because as I said, sometimes if you we usually check for lump. That's what most people check for.
Okay.
Sometimes you find a lump and it's benign. So then we just take it out and that's the end. That's for a woman. But for a man, as soon as you find anything wrong, don't do herbal, don't do pharmacy, just go to the hospital. Yeah.
Now let's talk about the lump issues.
Okay.
As a lady, your breast, there is a lump in it.
Okay.
Or there isn't, so that I know. I know.
Whether you're on your own or not.
Yeah. Like, naturally, there's supposed to be a lump in your breast.
Okay, so it depends on how you feel it, how you do the examination. Okay. And it's not all the breast cancers that start out with a lump. There are different other signs that you might notice, but I guess the lump is more popular. So it depends on how you do the examination. If you press backwards to your chest wall, so you first of all you use your four fingers. Yes, like this, the pulp of it.
Okay.
Like, yes, not here, but here.
Okay.
And you are feeling for it.
Oh.
Okay, so you touch it to your chest. You are not likely to feel the lump there.
Okay.
But when you press it sideways, as the ligamentous tissue that hold it, there are little nodes, so there are lumps in that line. Not lumps per se, but I mean, for lack of a better word.
Okay.
You feel something if you press it this way, because all of them actually converge at the nipple area.
Okay.
To where the collecting duct is, where the milk is produced. So you feel something here if you press sideways.
Okay, so that one is normal.
Yeah, that's normal. That's normal. So then you have to press to your chest wall.
Oh, okay.
Press to your chest wall. So you can easily do it when you're lying down.
Oh.
Yeah. You can examine yourself while sitting up or lying down, but I find that personally it's easier when you're lying down. Yeah.
So if you're able to press it towards the chest area and you feel a lump, then that's questionable.
Yes.
But then when it's like this and it's connecting to the nipples, it's very normal.
Yeah, that's fine. That's fine. So because sometimes there's some confusion as to am I doing it well, I'm not doing it well, is there a lump, is there not? That's why at least with the advocacy, once every year you get a professional to check it for you, and then you can go home in peace.
Wow. So I heard that sometimes you don't have to wait till you're grown to go and get checked up for breast cancer. I heard from 20 years and above it's advisable to get checked. What's your take on that?
Well, general advice is okay. So my advice is that it's a case by case. You should know yourself. You should know what diseases run in the family. You should know the things that you've been exposed to in your life. So the risk factors that we talked about, if there's some that you fall into that category, it gives you a higher level of suspicion for anything. If you don't fall into any of the categories and you just continue with the breast self exam,
Okay.
that's one. So the aim of that is for you to know how your breasts feel.
Okay.
So everybody and their own. So that if you notice anything abnormal, then you go and search for help.
Okay.
So sometimes people come and they're a bit worried. They want to do a scan. They want to do this. They want to do that. It's not always that it is what we say indicated.
Oh, okay.
Yes, but at least for women above 40, they usually get to do the mammogram.
Okay.
And because for younger women, the breast tissue is denser, like there's more fatigue, the ultrasound helps.
Okay.
And I mean, technology helps because it's been noted that actually sometimes the mammogram, the scans pick up things before we can feel anything. So it depends on your exposure. It depends on your family. It depends on what is happening. It's case by case. Yeah.
Okay. So when someone gets breast cancer, does it affect the size of the nipple?
It can affect it. So there are different manifestations. When breast cancer starts, sometimes some people have normally flat nipples or what we call inverted, like the nipple is inside. Yes.
Yeah.
But if you have a normal nipple and all of a sudden you see that it's going inside,
Oh.
you have to get it checked
Some
out.
people, their nipple is low key. It's just flat till maybe they are cold or something before it
Yes.
actually stands out.
Yes.
What about that?
Oh, that one is reactions, like your
okay.
skin standing on end. But this one we are talking about, if there's maybe a lump, something you can't feel inside the breast tissue, it tends to pull on the structures. That are I wish I had a model here. Pull on the structures that
Like a model, as in like a naked body.
not
Oh,
a
like,
model of a breast. Like, yeah.
Oh.
So
Yeah, sorry, we don't have that.
no problem. So so in the breast, it's connected to the skin via some ligaments, I guess, for a lack of a better word. If there's a mass in there, it sort of pulls on it. So one of the things that you can see is what we call nipple retraction, right? As you said, the nipple going inside. Sometimes you see a dimpling in your skin, in the skin of the breast.
Yeah.
Dimpling, as in it's going inside.
The skin itself.
Yes, it's going inside. Sometimes too, your breast will become one naturally. One is bigger than the other, but you can see an unnatural increase in one over the other.
Oh,
So
okay.
that's also a sign.
Okay.
Sometimes you actually get swollen, like engorged, and then the skin looks like an orange peel. There are some
Wow.
manifestations like that. And then sometimes you have a nipple discharge, which is not milk. Yes. So you have
What is
like,
it?
no, you have like discharge, like fluid, liquid from the nipple. That's one's also a sign that you have to get your breast checked out.
Wow.
Sometimes, so unfortunately, you can develop a sore on your breast. So those are all danger signs that you have to check out, apart from, having feeling an obvious lump. Yeah.
Okay. What are some ways we can prevent breast cancer from occurring?
Yes. So that's why we talked about the risk factors.
Yes.
Yes. So the ones that we can do something about: the smoking, the drinking, the oral contraceptive, the what else is that? The so life choices. When you get married, when you give birth, when you get pregnant, breastfeeding. Sometimes people don't want to do that because it takes time. The breastfeeding, I mean, it takes time. They're tired and all. But if you try, it actually does help you.
Wow.
Yeah. So these are the things that we can do about it. And then if you realize that you fall into the non-modifiable range, those with genetic mutations, those that are have relatives, third degree relatives that have the breast cancer, sometimes you have to make radical decisions. So like Angelina Jolie, like this, she had her mother had ovarian cancer, I think.
Okay.
So she has a genetic mutation for that. So what she did was a prophylactic mastectomy. So she took out her boobs surgically.
But what her mother had was ovarian cancer.
I think ovarian or breast, one of them.
Okay.
But you know the BRCA2 that I was talking about? Yes, that line.
That line.
So for something like that, you might have to take a radical decision of doing those things so that you can preserve your life. So you take out your surgically, have them removed.
So that place is going to be flat or
oh no, they are prostheses. So they put something there.
Oh.
Yes. So it doesn't make you less of a woman. It makes it is a radical decision, because to be like you are taking some part of you away. But when you understand the importance, the kind of longevity it will give you in life, the kind of freedom it will give you, it might be a risk worth taking. So those prophylactic procedures can help to prevent it from occurring.
Wow.
Yeah.
So what are some of the stages of breast cancer and the way they impact treatment?
Okay, so there are different categories for staging. A common one is the TNM staging. They stage it depending on the size of the lump, on whether it has spread to other areas, and then they're what we call lymph nodes. They're like the rubbish collection system of the body. Okay. So whatever is in there, and they're assigned, they have different assignments. So for the breast area, there are some in the armpits and there are some in the neck. So we check for that, checking for spread. So we check whether those lymph nodes have been affected. So based on that, then we know whether we have, and then that's good. We know whether we know what mode of treatment that we'll offer. So if it's just the lump is small, it hasn't spread, we can offer to take out the lump, do a breast conservation surgery, and then so your breast will be normal. But then usually they add radiotherapy to prevent it from recurring. There's also chemotherapy when it's spread out, and then there are some breast cancers that have hormone receptors. They are hormone specific, so we add hormone therapy to it. So usually it's either we do, the options are the surgery you can take out the lump, or sometimes you have to do the mastectomy. Then there's radiotherapy, that's when they use radiation at that local area. Then there's chemotherapy. Those are very strong medications to kill the cells.
Wow.
That's the one that most of the movies are about. You lose your hair, your eyebrows. Yeah. Yes. So it's challenging, but those options are there. And then the hormone treatment as well. Wow. For the hormone receptor positive ones. So depending on your case, again, we look at everything, the history, how far the cancer has gone, the staging, and then we choose from these options for you. So this is usually done at an oncology center or a specialist center. So then you know that you'll be in good hands. Yeah.
Wow. So what has breast cancer treatment evolved like over the years? How have they evolved?
How they evolved? Well, newer medication have come up, newer surgical techniques have come up. So most people feel like, oh, breast cancer equals a mastectomy. Mastectomy is the removal of your breast. My chest will become flat. But now it's not like that. So there are different ways they can take out just the lump. And then plasty your chest so that it looks even nicer. Yeah. And then even when there's a mastectomy, there are prostheses available, like the artificial boobs that you can get in. And for the medication some of them, chemo is a strong combo of drugs. But over time, they tend to develop better drugs that are easier for the body to handle and work even faster. And then the hormone receptor therapy as well. I think that's a new-ish development. So those ones also target a specific type of cancer, and then they work well. So a combination of all of these methods makes the treatment process easier.
Wow.
Relatively easier. I'm not downplaying the time and effort it takes, but it makes it relatively easier.
So is there any case where someone doesn't detect it early and the person has to die with it, or maybe the person detects it way too late in the stage and then the person's able to do something about it?
Yes, so there are many cases where people don't find out early. So that's why, um, because it's so common and yet people often ignore it, they've set out a whole mark for us to make noise about it, so that you step out and you do something about it. So statistically, it's commoner in the developed world,
Okay.
but the death rate is higher in the developing world because most people in our part of town come report to the hospital in the late stages, stage 3, stage 4, often because, women have a high endurance rate. So if she finds a lamp or she sees something, she just brushes it off because she has children to take care of, she has a job to handle, she has this.
Has what to take care of as well.
Yeah. So till somebody notices something or pushes the person, or the lamp now becomes an ulcer and it's smelly and she finds it difficult to hang around people.
Really?
Oh yeah, it's not very easy in the end stages. That's why it's important to do something about it early.
Wow.
So the information that we get um from health workers during this time has to sink into your heart so that you know what you are about. Because the end is not so pleasant at all.
Wow.
It's not for nothing that a lot of noise is being made about it. It's very sad, but it's just because people choose to people are sometimes ignorant about it.
Yeah.
Some people to choose
To not go and
to not
check.
do anything about it because and again, you see, we live in a very spiritual, we're in a very spiritual part of town as well. So sometimes the healing part, the what do you call it?
Miracle.
The miracle healings, the spiritual things all come in. So she finds a lamp, she goes to the pastor, they pray over it for over a year. She's not seen anything, then she decides to go to herbal because she knows that she comes and they think, I mean, she has that breast cancer in the mind, but she thinks it equates a mastectomy and she cannot live without her breast. So she tried other things, herbal for a while, till she comes to the hospital and then it's too late. So we have all of those things. And then you also obviously have a success stories where people who have been, received a little bit of education from here and there, they know what is happening. So they know how their breasts feel. So they come to the hospital when there's a change. Come, we check it out. They have any concerns, we could do a scan and see what it is. We might find something. Sometimes it's just a small mass. We test it, so we know that okay, it's cancerous. It's small. So we deal with it, they can live a normal life afterwards.
Wow.
Yeah. So there are both sides of it.
Okay. So the ulcer that appears on the breast, does it come in the whole a pimple or it just comes as a slope and that is it?
It's so sometimes there's a lump in the breast. And it becomes bigger. And as it cools on the skin, the pressure develops. So it's more like a rupture, not like a. So it's not coming from the outside; it's coming from the inside.
Mm. Wow.
So you have it's not very pretty. So it's not an issue. We really hope that many women do not get to that stage.
Wow. So if someone wants to go screening to check if the person has breast cancer or not, or if the person is safe, is it expensive? Or sometimes I feel like the cost is the reason people are not even going to the hospitals to get checked or tested when they have any assumptions.
Well, that is true. We always run away from health costs.
Yeah.
But this October, I really do not think you have an excuse.
Yeah, because a lot of people are doing it free.
Yes.
But then do you know, I feel like people feel like, what if I go and then they find out they have I have breast cancer, then the whole thought process behind that. I feel like that also deprives people from getting that special health care.
Yeah, that is true. But all we can say is to give you the information and to hope that you actually act on it. So listening to the podcast and shaking your head and thinking that for somebody else doesn't do the trick. You have to apply it to yourself. Because indeed, you could receive that news, but again, you could be free, you could be fine, and they'll shake your hands and say, "See you next year." So you have to own it. You have to own your health. You have to make decisions that improve your health.
Yeah.
You have to be very mindful of what is going on and learn as much as you can. Right now, the internet is very a little bit helpful. Ask questions, okay? And even after October, for most of the government hospitals, I don't know how the prices go, but a screening is pretty much a consultation. It's not like a surgical procedure or something that would poke a hole in your
pocket.
in your pocket. Yes.
Yeah.
And I can tell you that one consultation fee is way less expensive than chemo or surgery.
True.
So weigh those costs and then take the step. Just gather your wits about you. Sometimes you are really, really afraid that you might get some bad news. But that is why you should read. Sometimes you realize that you really have no cause to be afraid and just go, you're confirmed to be fine, and then life goes on. But the most important thing is that you took a decision about your health. A lot of times people are more reactive about it. And when I fall sick, then I do something. What about doing something so that you don't fall sick? Yes. So let's think about that and approach it that way.
Okay. So when someone gets cancer, breast cancer, how long does it take for it to develop to the first stage or like the worst stage where the person starts showing like actual symptoms of the ulcer develops when they're trying to probe through the skin? How long does it take? A year or more or less?
Well, it depends. It depends. It could take a few months to a year or something.
Wow.
Depending on the person's, depend on the person. So some people are already a bit unwell. Maybe they might have hypertension or diabetes or something, or any of those chronic illnesses. Some people are they are already immunosuppressed. Some people have already received cancer treatment for other kinds of cancers. So depending on the treatment that you receive, that can also suppress your immunity. So it really depends on the individual.
Wow.
Yes.
Wow. Okay, so and then you mentioned that a woman has support systems in everywhere for their husbands, their children, their workplaces, even for their friends and their neighbors. So when a woman survives breast cancer or when he or she gets breast cancer, are there any psychological treatment or help they could benefit from?
Yes. So for the medical team, we work in what we call a multidisciplinary team. So you have maybe the surgeons, different types, the general surgeon, the plastic surgeon. But I mean, the nurses as well, they help a lot because the patients spend a lot of time with them compared to the doctor that does the surgery. But then also we have the psychologists, the clinical psychologists that help them go through it because it's not easy. When you are diagnosed, that day might be the turning point in your life. That day might be the day that your husband walks out on you or something bad really happens. So you need the psychological care on that day. As you go through the process, it's long. It's not a 3-day malaria course. Again, it's long and it's hard. You have, as I said, the chemo drugs are really strong. So you might have difficulties. You might not feel like you are yourself anymore because maybe you're on chemo, your hair is falling out, a hair that everybody used to compliment you about.
Oh my God.
You feel tired all the time, you can't eat. So it's a difficult process. But there's help available, psychological help. And then again, let's not overlook the family too. So a supportive family, you can't exchange for anything at all. You can't exchange for the nicest nurse or a health worker. So the husbands themselves, the children encouraging you. Sometimes there'll be days where you'll be crying because you feel very miserable. So those ones also help. So if you have a relative that has that, you have to be mindful of how you treat a person. You're not skirting around the issue and pretending that it never happened, it never occurred. But then you are supportive about it. The person actually really, really needs you. So that's not the time for ultimatums and second wives and threats and stuff like that.
True.
Yeah.
So what is the typical recovery process of someone that has lived with breast cancer and survived?
Well, so after the treatment, they do tests to assess how well you are doing. They do scans to see maybe if there's a lump after the surgery, you check to see if they do microscopy to see if there's any spread still. You keep testing and scanning to make sure that the primary lump is dealt with, and if there are any spreads to other parts of the body, they've also been dealt with. And then at a point, they might say that okay, you are in what we call remission. I said it's gone, it's gone, it's okay, it's gone. That's primary one, it's gone. And so you keep following up because after remission, unfortunately, that people that develop it again.
Hey.
Yes. So we keep following up and making sure that doesn't return.
So how long should they keep following up for?
Oh, it depends. This one is like a case by case basis. So you might follow up to a year, 2, 3, to make sure that you are fine.
Yeah.
So it's not a one size fits all.
Okay. So, and now you mentioned about new recovery processes and tests of how to, you mentioned the mammogram, you mentioned some other recovery process of breast cancer and the scanning, those technical ones here. Could you please touch on some of them for, no, like, wait a second. Let me get it right. So yeah, so you mentioned how people can get treated for their breast cancer. You mentioned some new technologies that have come in place to help with that. And you mentioned one new one aside the mammogram and the others. What other treatments?
So I mentioned for treatment modality.
Chemotherapy.
Yes. The mammogram is for
The scanning.
investigating.
Investigating.
Yes.
Okay.
So for the investigations, it's pretty much it's 3 modalities. So the clinical one, the breast exam, and then there's the mammogram or the ultrasound scan.
Okay.
And then if there's any lab to be picked out, it's what we call a core biopsy. So you take a sample, a sample, and then we test it and see what kind of tumor it is. Okay. It can be benign or it can be. They have different features under the microscope. Yeah. So it can be benign or it can be the cancer itself. So based on the 3, they were able to determine for real that you have breast cancer. Mm-hmm. So as I said, the drugs for the chemo they are different.
Oh,
this I don't think I should
so
say this.
they are not any new treatment over the years. That technological treatments.
No, it's drugs. Some of them are hormone related.
Oh,
And then the surgery and then the radiotherapy. So it's a combination of these 4.
oh, okay.
Yeah.
Okay, so technology hasn't come in place to help people with breast cancer.
Like AI
No,
or like robotic surgery.
I don't know. Like,
So what I'm saying is that so the drugs.
so okay, anyone that like has ever dealt with breast cancer survives on drugs only.
So all of them are not drugs. There's surgery.
Okay, surgery.
Surgery is like you cut in, take out the lump. Yeah. The radiotherapy is light.
UV therapy.
Yeah,
that one.
It's the radiotherapy is radiation.
Okay.
So that's energy beams used to kill off some of the cells.
Wow.
Then the chemo is the drug.
The drug.
Yes, and then there's tamoxifen. There's a hormonal drug. So some of the cancers have hormone receptors that are responsive to a drug like tamoxifen. So you take it orally. It's part of the modality that we use to treat.
What about immunotherapy? Does it help with the treatment of breast cancer?
Immunotherapy.
I just read it somewhere.
Immunotherapy. Yeah. Well, which one?
Their tires for accessory.
No, I did that context.
Okay. Breast cancer.
Okay, to my knowledge, I haven't met that yet.
Okay.
Yeah.
Okay. How many minutes have we done? So let me see if I need to add some.
But have you brought up the myths?
Yeah, that's the next. Okay. Yeah. But then have you heard about immunotherapy? Like in general, not in relation to breast cancer?
Well, so immunotherapy generally deals with what's called autoimmune diseases.
Okay.
So like lupus, SLE. Definitely if you're familiar with SLE. So so the body fights off infections. there are external things that get inside, and the body fights them off. So that's when you fall sick, you have fever and stuff. But sometimes for some people, the body's attacking the body itself. Oh, so you have different manifestations. Yes. So for that one, the immunotherapy, there are different conditions. But immunotherapy in a general sense are drugs that help to modulate your immune system. Teach your immune system not to attack itself. Okay. So that's the context in which I understand the immunotherapy I'm talking about. So I'm not really familiar with that in breast cancer.
Okay. Okay. What are some of the misconceptions about breast cancer would you like to address for us or dispel for us? God. You want me to read? Yeah, no problem. Okay, so the first one I have here, someone says breast cancer is caused by the use of deodorants.
Deodorant. Oh no. So sometimes people base their knowledge on anec- anecdotal like stories.
Oh, true.
I think most people use deodorant. So then why are we not all having
Because when I said, I was like, how is that possible? Because I'm using it every day.
So the person doesn't use deodorant.
Oh,
Sorry.
I didn't even try to say that. So maybe the long exposure to deodorant.
Yeah, but your parents have been using deodorant for like forever.
Sure.
So when you get information like that, you generally have to think around it. Okay, so who have been using deodorant for 20 years? As a person develops, how many of the people who use deodorant over a period of time develop they can form your conclusion from there. Yeah.
Okay, so they also say that carrying your phone in your bra can also cause breast cancer.
Well, I haven't seen that in the literature.
Okay.
Yes. But generally people are worried because they think about the radiation. Is it microwave? The phone waves yes. But again, for the risk factors, how they find them out is that they do studies. So a whole group of people and then they study you. So far they haven't done a study on carrying your phone in your bra pocket. So
Okay.
and now I don't know, these phones will not fit in your brow.
I don't know. Like I don't know who is feeding people those information to be asking themselves questions like that.
A lot of young women think because they are young, they are not exposed to getting breast cancer. What's your say about that?
What I would say is that age is not the only risk factor, and now even women as young as 18 are developing breast cancer. So we all must be aware of it. Again, there are other risk factors. So the smoking and the alcohol, the obesity. So if you are young and you're obese, your risk increases. If you are young and you smoke, it increases. So it's not just you waiting till after menopause.
Okay, so there are also people claim there are some natural cures for breast cancer, and um, people claim that, or there are claims online that there are certain natural cures for breast cancer. What do you think about that?
Well, for one thing, I wouldn't comment too much on something that's not my field.
Okay.
The natural parts, they should do their whole thing. But what we have seen is that, again, people go through all of those parts, maybe because they trust them more, because they don't want to pay too much. But you go round and round and round, and you still come back to the hospital.
Sure.
So you come back late too. So it's just ironic because you come back to the hospital late, and that's when, unfortunately, it will just get worse, and you probably die, and to be like, oh, she went to die in the hospital. So when she was fine and she was able to, she just had a lump, and we could have done something about it. She was walking about,
Visiting.
doing the prayer camps, doing the natural remedies, and then when it became very, very bad, as I said, people, it's sometimes the ulcer that brings the sore that will bring the person to the hospital, and by then it's very advanced. There's very little that we can do, and it would be like, oh, she came to the hospital, 37, that kind of vibe.
Yeah,
And to be like, oh, it's true, like there's no hope. But there are people that came early.
And then
And
they
as I said, there are
survive.
different, yes, and you survive and then you're able to, at least advocate for that. So, as for the natural guys, I don't know what they are treating. Maybe it's not breast cancer. But, I mean, as per my experience, it doesn't do anything.
Okay. So what advice would you give to men and women out there in this breast cancer awareness month?
Okay, so be proactive. Okay, take steps to ensure that you are well. This is about breast cancer. It's about having information. So you know your background. You know the things that you have been up to. You know the risk factors that you might have. The important thing is to know yourself, know your breast, know how it feels like, so that if there are any changes, you can let the health worker know. Take every opportunity every year. That's just once a year to get yourself checked out, so that you can be sure that you are still on the right path. But proactivity is a key. That is what will keep you alive. Yeah,
Thank you very much, Klenam. It was nice having you.
Yeah, welcome. It was nice being here.
Okay. Thank you guys for watching. Do not forget to tap on the like button, subscribe, share the video, and comment as well. Thank you for watching. Peace out.